Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, Dr. Vikram Jayaprakash here. Hope you're all keeping well and safe. What I wanted to cover today was regarding hair transplant. Now, not everyone is going down the road of having a hair transplant, but one of the common misconceptions I find when I'm consulting is people don't have a great idea of what to expect after they've had a hair transplant. Because they come in going, I'm not happy with the amount of hair that I've got or the shape of my hairline. I want to correct that. But we have to sort of adjust their expectations of how that's going to progress over the next period of time. So if you have a hair transplant today, you're not rocking with a full head of hair by the weekend. It takes a while to grow, and it doesn't happen at a steady state. It goes through different phases. So what you have is that you have these tiny, and generally most of the time it's tiny little grafts that are planted. What I mean is that the length is anywhere between 1 to 2 millimeters long. So tiny little stubble hairs, and the day after surgery it looks fine. You can see how it's all progressing. But and the period that you really need to look after these grafts is that first 5 to 7 days after surgery. That is when you could, with any sort of traumatic event, pull these grafts out and they're not going to grow. After that period, the clot around each graft has solidified and it's not going to pull the hair out any subsequent to that. But what you'll find after that first week period, within that first month, is that the hair, some of the transplanted hairs will fall out. Okay, that's normal, and it's only because just the notion of transporting the graft from one part of the scalp to another actually switches off that the cycle of that follicle. So you'll find within that first month the hair may shed. So at the end of that first month, the area doesn't look as densely packed as it was immediately post-operatively, and that can be quite disconcerting for some people. And there's probably a bit of a status quo in that area for about 3 months. So whatever hairs that you have remaining at the end of that first month will carry on growing, and they'll probably grow at a normal rate of about 1 centimeter per month. But the area still looks sparse, and I generally find around month number 2, month number 3, I get these panic phone calls from patients saying, oh my God, the hair hasn't taken, it looks horrible. And you just have to reassure the patient at that point, because at the end of that 3-month block, so at the beginning of month number 4, because of the new hair cycle that has started, you'll see a sudden throughput of hair. And it happens like clockwork. And everyone you speak to after that 4 months say, oh yes, I suddenly see something coming through. And then there's a gradual growth of hair subsequent to that. And it doesn't happen at a steady state. It sort of waxes and wanes. But generally around 6 months, you've got 60 to 70% of the hair has come through, and then it take the last 6 months, the last 30 to 40% will come through as well. So it takes about a good 10 to 12 months really from when you've had surgery to see what the final outcome is. Now, if you have long hair, then it's going to take even longer, because not only are you waiting for that period of time for the hair to come out, but then to grow to the length to match everything else, that takes longer. So you have to be aware and understand that. Can you do anything to speed up the process? Well, I generally don't. I just sort of tell patients, this is what you can do, this is what to expect. But you can use minoxidil. I know people that are advocates of using minoxidil specifically post-surgery. Because it acts as a stimulator, it will speed up the process by which the grafts come through. Now, it's not predictable. It varies from person to person. Some people will get a much more rapid response. Some people will get, faster than normal, but less of a rapid outcome. But the key to remember is that if you've got two individuals, one who uses minoxidil, one who doesn't use minoxidil, the outcome is going to be the same. It doesn't change the outcome, it just changes the speed at which you attain that outcome. And sometimes the slow process of which the hair returns back is actually quite advantageous to certain people, because it's not a massive difference from pre-up to having the final outcome. Now, I know people want instant gratification and they want the outcome to be quite quick, but for people on a day-to-day basis who are seeing other people, it's nice for the changes to be small and subtle over a gradual period of time, so people don't, anyone else doesn't really comment on, oh, what's going on there. It's something that's been gradually happening and becomes normalized. So the key point is that it takes a while from start to finish, and there's that initial phase within the first 3 months that you don't see very much happening. But again, this is something that you should have a chat with your surgeon, and they should be able to talk you through the process. But I hope you find that useful. Stay safe, and we'll see you soon. Take care.